Hello, First Baptist Family of Faith and all of our other friends. Thank you for joining us today. Today we have Dr. Carl McCurdy with us. Dr. McCurdy just celebrated 38 years of practicing medicine in Jasper, and we are so grateful to have him as part of our family of faith and to offer us some wisdom and guidance as things are constantly changing with COVID-19. So thank you for being with us today, Dr. McCurdy. And if you could just share how things have changed with COVID-19 in the recent weeks.
Wow, we say that that just slips off the tongue now, doesn't it? COVID-19, COVID-19. I mean, 5 months ago when I gave the first little video talk, everything was new and unknown. We have learned so much in the last 5 months. For example, we've learned a lot about in the hospital how to take care of very, very sick patients with COVID-19, and the doctors in the intensive care unit they're doing a great job, and they're finding a lot of things that we can do to help people. We've learned a lot more about the virus itself and about how human beings react to the virus, how it infects us, how we can keep from getting infected, and we just feel a little bit more in control now because we know things that we didn't know at the time. So to recap, what we have is a brand new virus to humans that came to us through spread from other countries, and now is spreading in our community in the United States. We call it a pandemic. It's new to us, so nobody has any immunity. Now, you may be a healthy, resistant person, but nobody has any immunity. It's a respiratory virus. So we know that that we catch it by droplets from an infected person that we somehow get into our respiratory tract. So the most likely thing is droplets from somebody who may be coughing or sneezing. Also, we know that there is some spread from aerosol, which is just the moisture that leaves our mouth when we talk or sing or shout. We don't think that we get very much from surfaces, from hard surfaces and materials and things like that. But where we talk about hand washing, you could very easily cough into your hand, shake somebody's hand, and transmit that droplet by that handshake. And then that person could then just rub their nose that's all they would have to do to transmit the droplet to their own respiratory tract. We know that it takes a minimum amount of the virus to infect somebody, and we know that the incubation period averages about 4 days from the time you're exposed with enough virus to infect you. It begins to grow in the upper respiratory tract, and in susceptible persons goes down the respiratory tract and causes a pneumonia. We know that there is a great variability in how severe the infection might be in an individual. The majority of people do not have a terribly severe infection. In fact, different estimates from different studies say that 20 to 40% of people who get infected have zero symptoms or minimal symptoms. So that's the asymptomatic person who's walking around with the virus, who's not really having any significant symptoms. And only a very low percentage, something like 5% of people who get it have what we would call severe infection. That severe infection that would lead to respiratory failure or the other inflammatory side effects of a severe respiratory illness. So we know all these things now. We know that the average person has a 95% chance that he'll never get it, and we know that that there are people who are more susceptible to the severe illness. Most of the severe illness is in older persons, and age is an absolute predictor of severity. So the older you are, the more likely your infection will be severe. The other things that predict a severe infection are what we call comorbidities, other medical illnesses like heart disease, high blood pressure, diabetes, emphysema, chronic lung disease, even obesity. We know that there are disparities according to race, and possibly even according to socioeconomics. So we know a lot more now than we did 5 months ago. And I think, like I said, for a lot of people, knowledge is power. The more we know, the more we feel like we're in control. So all that being said, we're still a pretty good while away from a vaccine. And we're going to have to live with this. I think I predicted that. We're going to have to live with this a while longer. But we're doing pretty good right now. I'm optimistic. We had we pulled together as a church and a community, and really cut down the spread in April and May. We saw increasing numbers after Memorial Day and 4th of July, and we've done a good job now of making the numbers go back down by our social distancing and the measures that we've taken. If we can maintain our attention and not get COVID fatigue, if we can maintain this attention and protect ourselves for a few more months, we're going to be in much better shape. So you mentioned some of the measures that we've taken at church, for example, to reduce the spread. The first thing I did want to say is that the concept that some people talk about herd immunity. Just let everybody get it, and when everybody gets it, that'll. Well, that's interesting in theory, but we don't do that with meningitis. We don't do that with chickenpox anymore. It's really a little bit silly to say that we should do that and just let people get it, because that's a high price to pay. There's a lot of people who would get very sick and a lot of deaths that would happen if we tried to just let it go through the community and achieve herd immunity. So the people who are talking about that really don't know what they're talking about in terms of the price that it would cost the community. What we really should do is try to prevent infections, prevent transmission. And there are a lot of things that we can do. The mask, the face covering, is each individual's prime. That's your opportunity to help prevent spread. Social distancing, meaning staying away from people and, for example, not traveling and not getting into groups. Those are also weapons that we have to prevent spread. And the way I see it is, think about slices of Swiss cheese, and each slice of Swiss cheese has some holes. So in terms of wearing a mask, well, that's a measure that has some holes. It has some holes, but then take another measure, like staying further away from people. Well, there's another slice of Swiss cheese. And then there are some things that will get through holes of both slices. We'll add another layer, which might be definitely staying away from anyone who's sick. And then add another layer, which might be not traveling and not flying on vacation. Add another layer, not going to a group of people that you usually go to and spending hours with them if you don't live with them. There's another layer of protection. And I think that the more layers of protection that you can make, the more likely you're going to get through all of this without an infection and without spreading the infection. A lot of people are doing the maximum that they can. And let me mention one thing about time and proximity. So it stands to reason that if we're talking about droplet and aerosol spread, that if you and I have to interact, then the less time we interact, the less likely that either of us will give the other aerosol or droplet spread. And then the closer we are, the more likely there will be some spread. So that's your distance and your time factor. I went to the high school football game. I was on the sideline around a few people, but I masked and we were outside. And most of the scientists have not seen very much spread in the outdoors. So if you have to get together with a group of your friends, do it outside and keep your distance. So that's sort of the way I see how we're going to get through this, is with different measures of protection. Let's see. We've taken some of these measures at church. So when we start back to church in person again, we'll have temperature checks. So somebody who's obviously ill will know that and not come to church. We'll all be wearing masks. We will all use hand sanitizer. And we will sit in family groups so that we won't be sitting for a prolonged period close to people that we don't live with. We haven't had church meals, so we're not eating with people that we don't live with. So those measures, I think, are, can you think of any other measures that we're doing? We're doing a lot of cleaning.
We're also doing contact tracing. So we're writing everyone's name down and phone number just to ensure that we can contact people if for some reason we hear of a case that's been in the church.
Right. So that's something I forgot to mention. So that's great. And that's so there are individual things that you can do, and then there are societal things that you can do. And then as a society, we can do as much testing as we possibly can, and then contact tracing. I heard an article on the radio today from a doctor in Michigan who was in charge of a summer camp, a sleepaway camp. And we had a camp in Georgia that really had some problems. Well, they had a camp in Michigan that had 500 kids for 5 weeks, and they didn't have any problems. When they tested those kids before they came and after they got there, and anybody who was sick, they immediately tested. But they actually treated the campers, they wanted them to stay like family. So campers who were living in a cabin stayed in a cohort. They called it a cohort. They did their activities together, they ate their meals together, and that sort of thing. And then if somebody in the cabin got sick, then everybody in that cohort stayed away from everybody else in the camp until they tested and could see whether or not it was the COVID. I think that's what the college football teams are doing. That's what the baseball teams and professional baseball and basketball are doing. They're staying in cohorts that are similar to families, small groups. So I think those measures are the things that are going to get us through until we get a vaccine. So you also asked me about vaccines, and I'll tell you what I understand about vaccines. You hear people toss around phase 1, phase 2, phase 3. Well, when you study a vaccine, phase 1 is just to see if it's safe, just to see if it's going to hurt anybody. And usually you use medical students as volunteers at that point. Now you pay them a little bit. So you give medical students the vaccine, and then you do blood tests on them 2 weeks later, 4 weeks later, and you look to make sure that it didn't hurt the liver, that it didn't hurt the blood counts, that it didn't hurt the kidney function, that sort of thing. So phase 1 trial is to see if a medicine is safe. Phase 2 trial for a vaccine is to see if it makes an antibody response. So the phase 1 trial only takes a few weeks, and phase 2 trial takes several weeks. You give the vaccine, and then you draw blood from the person you gave the vaccine to see if they've made antibodies, the antibodies that are similar to the antibodies you make when you've had the vaccine, when you've had the illness. And phase 2 takes several weeks, maybe 2 or 3 months. And then phase 3 is what everybody's shooting for. So if you've got a vaccine that seems safe, and then in phase 2 you show that you have an antibody response. Phase 3 question is, does it prevent infection from the virus? So phase 3 volunteers get the vaccine, and then they go back into the workplace and they go about their business. And you watch, and phase 3 volunteers are matched with people who did not get the vaccine. And then you have to watch for a long period of time to see whether more people get the vaccine more people get infected that are unvaccinated compared to people who were vaccinated with the phase 3 vaccine. And you want to see that curve separate. So you want to watch across the weeks and months to see that the people who got the vaccine did not get infected, people who did not get the vaccine do get infected. And you set your standard for the study as time goes on to see how those curves may separate and how you can prove that people who got the vaccine get infected at a lower rate than people who didn't get the vaccine. So, for example, in the average flu year, about 2.5% of the population gets the flu, gets influenza. In a bad flu year, it may be more. In a very mild flu year, it may be less. But in the average flu year, about 2.5% of people in the population who are not vaccinated get influenza. When you get a flu vaccine, if you take all the people who get a flu vaccine, only about 1% of those people get influenza. So as you compare that then, that's a better than 50% risk reduction. So if you get a flu vaccine, you've reduced your risk of getting the flu. You would rather be in the group of 1% than the group of 2.5%. So that's sort of how it will look. If a COVID vaccine is effective, then a lower number of people who get that vaccine will get COVID in the next few months or year or so. There's still a lot that's unknown. Even though we know a lot, there's still a lot that's unknown. We don't know how long immunity might last. We know that people who have antibodies to COVID, who've had COVID now and have antibodies to them, we know that they seem to have immunity for for a few months. We've only had it out here for a few months, but it looks like they probably are immune. We don't know if there are carriers. There's a lot that we don't know about that, but I'm looking forward to getting a vaccine, to having it available, and to getting it. I think when you look back, the fastest we've ever brought a vaccine to market was about 4 years from start to finish. That's what I read. I remember getting you told people that I was in practice for 38 years. When I was in medical school, we got the swine flu vaccine, Gerald Ford's program for the swine flu vaccine. And that was a real fast ramp up too. So somebody asked me once, and I counted up, I've had 40 flu vaccines in my lifetime. So I'm an advocate of the flu vaccine too. I really don't want to get the flu. I don't want to get COVID either.
Dr. McCurdy, let me ask you, as testing is more available, how should someone determine if they should go get a test or if they should just self-isolate?
That is a great question, and I want to separate testing into two concepts. One concept is getting yourself a test for how it can help you as an individual. And then the other concept is testing the population to help the population at large, what we would call epidemiology, looking at the population at large. So testing for an individual, sometimes we have to think, and we have to tell medical students when we teach them, don't do a test if it's not going to change your treatment. So the most important person to test is the one that's coming in the hospital, the one that's sick enough, the person who's sick enough to be in the hospital. And that's important because if you know it's COVID, then there are some things like remdesivir and steroids that are shown to be helpful for severe COVID-19 pneumonia. For an individual who is at home, for an individual who's at work, it's not as important to get an immediate test because there is no treatment for COVID-19 as an outpatient. The treatment is isolation, quarantine, drinking extra fluids. Most of the time the symptoms have to do with fever, headache, cough, sometimes runny nose. Should have mentioned that at the top of the video. If the symptoms go on to dehydration, weakness, difficulty breathing, those are indications that we may need to have the patient get IV fluids or be admitted to the hospital. So if you think that you are having symptoms of COVID, headache, body aches, fever, and you can obtain a test without unnecessarily exposing people, get one, because then you would know. And if you're at the point where you have those kind of symptoms, fever, cough, muscle aches, headache, then if you have COVID-19, your test should be positive. There are some false positive, false negatives, but not a lot, not very many. If you don't have any symptoms, the only reason you should get tested is for the other reason, for the population reason. So the population, the health department, the CDC, the WHO, organizations that are concerned with the health of the population, it's important for them to know who's infected and who's not, how much there is out there, and that sort of thing. And those are good reasons for asymptomatic, unsymptomatic people to be tested. But for the individual, if you have symptoms and you can have a test that's available. I can give you the 888 number. It's 1-888-881-1474. And that number is the free testing from the state of Georgia Department of Public Health.
Thank you for answering that. And how long should someone, if they have been exposed but do not have symptoms, would they need to self-isolate or would they need to get a test?
So if you've been exposed to someone who did test positive, then that average incubation, is 2 to 7 days, the average being 4 days. I think the schools are recommending 14 days out of school if you've been in the classroom with another kid who tested positive, and that is, I think, adequate to show whether or not you're going to get it.
And going forward in the coming months, as it gets colder and holidays are coming up, what would you recommend as far as holiday gatherings and different activities?
Most of these things are going to depend on how on how much risk people are willing to take, and I think that we would advocate using the most measures that you're comfortable with, the most measures that you can take. Like I said, adding those layers together, the more layers you put on your protection, the more likely you're going to get through the next few months without getting the infection. Everybody's going to, this is America, and everybody's going to have the ability to choose for themselves how much risk they're willing to take. If you're over 80 years old and have multiple medical problems, you should put absolutely as many layers together as possible and wave to your family through the window at the nursing home or the apartment. And everything below that would be a spectrum, I would say.
Thank you. Well, that is all the questions I have. Do you have anything else you'd like to add?
Well, let's see. I'm trying to think if there's anything that any myths that I wanted to dispel. I think the idea that children are immune is wrong. Children can get it, but they are most frequently asymptomatic. The symptoms kids can get, are usually very minor. But there is, the rare kid who gets a dangerous syndrome, that's an inflammatory syndrome from COVID-19. But hopefully we won't see very many of those. The main thing that I wanted to say was that we should still be about prevention and try not to get COVID fatigue and give up and say, well, it's inevitable. Whoever's going to get it will get it. I just don't think that's a smart way to look at it.
Well, thank you so much for your time and for sharing this information with us. This information will be posted on our website, so we are encouraging people to share it so people can just stay informed. Again, thank you so much, Dr. McCurdy.
Thank you, Anna.